I went to a physiotherapist because I thought I had arthritis in my hips, and my hips and back were really tight and really sore. But day to day was painful, just doing little jobs like vacuuming or getting something out of the bottom shelf, bending over, just little things like that you'd think, oh, I must have moved wrong. I must have pulled something. And then you'd realize when you stood up that, nope, that's just the normal creak. And then some muscle takes a little spasm. So it was very uncomfortable most of the time until you took a couple more pills. My physiotherapist sent me years ago when I was about 50 and I was having all the trouble for a standing x-ray. And then I discovered in my early 50s that I had scoliosis. And I was getting to the point with the scoliosis that the physiotherapist and my massage therapist were easing the pain, but it would be back within 2 or 3 days or 2 or 3 hours, depending on what I'd done. And I was ready to give up golf. And my husband thought, no, that's not acceptable, because if you give up golf, I may have to. So he went online and actually found Dr. Tony and said, I think we should go and talk to him.
One thing in common with all scoliosis patients is when they start experiencing pain, it's a result of compression. And this compressive forces is what initiates the pain. In fact, the more the curve worsens in the adult form as a result of compression, it's normally directly related to how much pain you're going to be experiencing. And as this increases, your pain will increase over your lifetime.
And I was kind of skeptical. I thought, I'm not 12 anymore, so my bones aren't as lucrative or easy to move, I guess I should say. And I said, if it's okay, I'll do week 1. If I like it, if we see the results, I'll do week 2. So I stayed for week 2 because I got great results. He was very positive that he could reduce the angles of the curve. He didn't know how quickly or how much the reduction would be, but he was confident that he could reduce the curves and get me a more comfortable lifestyle. Hopefully less pain, more movement, less pills, which has been 0 pills for months now.
So one of our key focuses in our treatment is something called decompression or elongation. We're elongating patients and decompressing their spine, and this has a great impact on not only reducing their pain or their symptoms, but really also in reducing their curvature. Because you take any curve and you go up, you definitely going to get a reduction. So reducing the size of the curve with elongation is one of the key principles that allows us to get results in any size curve or really any age of patient.
The treatment is a lot of stretching, a lot of vibration to loosen the muscles, and then adjustments to make sure that the spine is going the right directions, and then a repeat. So you don't really, it's hard to describe, but it works. The day-to-day chores are so much easier. So much of the chores that I'd have to get my husband to do, I'm back at them. So yeah, it's very rewarding. When you see the degrees that have been reduced and you're feeling that much looser in your body, I just think it's great at this age. I didn't really think it could be possible, and yet here I am.